Behavioral drugs, final exam, and VT&E review. Our first behavioral drug is Promozine maleate, or Prom-ACE. As you can see here, this one is coming to us in 25 milligram tablets. It also comes to us in 10 milligram tablets and 5 milligram tablets, as well as an injectable form. This is a tranquilizer from which family? This is a phenothiazine tranquilizer. A tranquilizer means that our animal will be tranquil or relaxed. It should not typically lose consciousness under the use of Promozine. This is popular in cases of travel and popular with some of our behavioral patients, such as animals that are nervous from lightning or fireworks. What reaction can boxers have? Boxers can have syncope or fainting. Which routes of administration? This can be given PO, IM, IV, and sub-Q. What does it do to emesis, arrhythmias, and histamine? This will be an antiemetic, so it will stop vomiting or reduce vomiting, reduce nausea in some patients. It will be an antiarrhythmic, especially in use among some of our inhaled anesthetics, such as halothane, which we do not have in the United States anymore. And it works as an antihistamine. Being an antihistamine, we do have to keep in mind that this is not a good drug choice to use for tranquilization for patients that are undergoing allergy testing. In the cases of allergy testing, this could ruin the results or ruin the animal's sensitivity to the allergens that they are testing. So other drugs are preferred when doing allergy testing. What does it do to blood pressure? This is going to decrease the blood pressure. So the blood pressure will drop, which can mean that it can be harder to hit an IV catheter. And when is it contraindicated? It is not contraindicated or not indicated against indication when we have allergy testing, organ dysfunction, especially of the liver is one example, sometimes the kidneys, and it also in very young and very old patients. How will this animal act under its use? Animals will act tranquil or relaxed. They will show less interest, but not necessarily lose consciousness. Now, under higher doses, we can have them lose consciousness in some situations. Diazepam, also called Valium, here it is again. Controlled? Yes, control Schedule 4. Avoid the brand or generic in cats. As we talked about earlier, we want to avoid diazepam, which is the generic format, and it will cause irreversible liver failure in cats when given PO. What other issue can it help? It can be an appetite stimulant, and it can also reduce the severity and frequency of seizures on an acute level. Remember that this has a short half-life, so it does not last long. It's great in an emergency situation for seizures, but not for the long-term treatment of seizures. In those cases, levetiracetam or phenobarbital and potassium bromide might be better drug combinations. Busparone, also called Buspar. Side effects, are there few or many? Very few side effects with the use of Buspar. What does it stop? This will stop fears, phobias, and urine spraying. What does it do to submissive animals? It's going to make them bold and sometimes more affectionate. Remember that this is an anxiolytic. This is going to lyse anxiety. Should owners expect it to work immediately? No. All of our behavioral drugs can take weeks, and in some cases even months to work entirely. And please remember too that there is no substitute for good training and behavioral interventions. Putting an animal on drugs only is not going to do them any favors. amitriptyline, Elavil. Behavioral modification is needed in addition to the medication. The seizure threshold will be lowered in some cases when it comes to amitriptyline. With thyroid patients, there is an increased risk for arrhythmias. Clomipramine, also called Clomicom. In addition to medication, we need to use behavioral modification. Seizure threshold will also be lowered in these patients. In thyroid patients, we can also have arrhythmias and drug interactions. The behaviors that it should help include obsessive compulsive disorders, dominance, aggression, fearful aggression, noise phobias, and separation anxieties. Don't forget that amitriptyline and clomipramine are both tricyclics, TCA, antidepressant drugs. Next up is fluoxetine, which also goes by the names Prozac and Reconcile. This is going to be an SSRI, or a selective serotonin reuptake inhibitor. What needs to be done in addition to medication? Behavioral modification. Contraindications include epilepsy, hypersensitivity to SSRIs, and animals that are on MAOI drugs. MAOI drugs react with many other drugs. And what is the washout interval or withdrawal period called, and for how long? This is for 6 weeks. So 6-week withdrawal period if we need to switch them to another drug or a drug that will interact with fluoxetine. Next up is celegiline. Celegiline is an MAOI. An MAOI, monoamine oxidase inhibitor. This also goes by the brand name, trade name, proprietary name of Anapril. Caution, there are drug interactions. MAOIs will interact with many of our drugs. And what needs to be done in addition to medication? Behavioral modification. Used for CDS. What is CDS? CDS is canine cognitive dysfunction. And caution with owners, human abuse. Why is this? This is because of drug shoppers. Human abuse is due to the metabolites of methamphetamine. Anapril, celegiline can be used for people to make methamphetamine. So you will run into people in some situations where they want to use this drug, they may lose it or run out, or the dog ate it all and they need more of it. And in those cases, make sure you check with the veterinarian before refilling or replacing the drug. Last up for the behavioral drugs is amatraz, also called Mitaban. And this is also going to fit into our antiparasitic classification. So be careful, there are drug interactions with this drug. This is used to treat mites, demodex, and scabies. And it also comes to us in a collar. So we do need to be very careful about animals ingesting the collar. It comes to us as a dip. And the dip can alter the animal's body temperature, and they may not be able to regulate their body temperature. There also may be some neurological signs and a lot of shivering when the animal is on a Mitaban dip, the liquid concentrate. It needs to be reconstituted very carefully so that we don't just use the concentrated version of it. Also, when we are working with any kind of dip, we need to put eye ointment in the animal's eyes. Keep in mind that dips have to cover the entire face. We need to very carefully apply it around the eyes, the mouth, and the nose. But we need to put eye ointment in the eyes to protect